Hello and welcome. Today we're diving deep into a condition that can silently threaten your vision: retinal toxicity. We'll explore what it is, what causes it, and most importantly, how to protect your sight. Retinal toxicity refers to damage to the retina, the light-sensitive tissue at the back of your eye, caused by exposure to certain drugs, chemicals, or toxins. One of the most well-known culprits is hydroxychloroquine, a medication used to treat malaria, lupus, and rheumatoid arthritis. While incredibly helpful for managing these conditions, long-term use can, in some individuals, lead to retinal damage. The exact mechanism of retinal toxicity varies depending on the substance involved, but for hydroxychloroquine, the process is understood relatively well. The drug accumulates in the retinal pigment epithelium, or RPE, a layer of cells crucial for supporting the photoreceptor cells responsible for vision. This accumulation disrupts the normal function of the RPE, eventually leading to photoreceptor cell damage and death. Specifically, hydroxychloroquine interferes with the processing of proteins within the RPE cells, and the drug binds to melanin. The damage often begins in the parafoveal region, the area surrounding the central part of the retina, the fovea, which is responsible for sharp, detailed vision. Estimating the precise prevalence of retinal toxicity is challenging, as it depends on factors like the specific drug being considered, the dosage, the duration of use, and individual patient characteristics. For hydroxychloroquine, studies suggest the risk of toxicity is relatively low in the early years of use, especially at recommended doses. However, the risk increases significantly after 5 years of use, particularly at higher daily doses, or when the patient has pre-existing kidney disease. Regular screening is crucial for individuals taking medications known to potentially cause retinal toxicity. The insidious nature of retinal toxicity lies in its often gradual onset and subtle initial symptoms. Early signs may include difficulty reading, problems with color vision, or mild blurring of vision. As the condition progresses, individuals may experience blind spots in their visual field, particularly in the parafoveal region. Some may notice difficulties with night vision or sensitivity to light. Advanced cases can lead to significant vision loss and even legal blindness. It's important to remember that symptoms can be subtle initially and may not be immediately noticeable. Diagnosing retinal toxicity requires a comprehensive eye examination and specialized testing. A thorough review of the patient's medical history and medication list is the first critical step. Examination typically includes visual acuity testing, visual field testing, and a dilated fundus examination to directly visualize the retina. Advanced imaging techniques like optical coherence tomography, or OCT, can detect subtle changes in the retinal layers, particularly in the RPE and photoreceptor layers. Fundus autofluorescence imaging can reveal areas of RPE dysfunction, providing further evidence of toxicity. Multifocal electroretinography, or MIFA-RG, can assess the electrical activity of the retina, identifying areas of reduced function. While there aren't specific subtypes of retinal toxicity related to the underlying causes, it can be helpful to classify cases based on the severity and location of the retinal damage. For example, toxicity might be described as early versus advanced, or parafoveal versus widespread, depending on the distribution of the damage observed on imaging studies. This categorization can assist in monitoring progression and guiding management strategies. Unfortunately, there is no cure for retinal toxicity. Once the damage has occurred, it is often irreversible. The primary goal of treatment is to prevent further damage by discontinuing the offending medication, if possible, or reducing the dosage under the guidance of the prescribing physician. Supportive measures, such as low vision aids, can help individuals cope with vision loss. Regular monitoring with comprehensive eye exams is essential to detect any progression and adjust management accordingly. The cornerstone of preventing retinal toxicity is awareness and proactive monitoring. Before starting any medication with the potential for retinal toxicity, patients should undergo a baseline eye exam to establish a reference point. Regular screening, typically annually after 5 years of use or earlier if risk factors are present, is crucial for early detection. These screenings should include comprehensive eye exams, visual field testing, and advanced imaging techniques like OCT and fundus autofluorescence. Open communication between the patient, their rheumatologist or other prescribing physician, and their ophthalmologist is essential. The prognosis for retinal toxicity depends on several factors, including the severity of the damage at the time of diagnosis, the duration of exposure to the offending agent, and the individual's response to treatment. Early detection and cessation of the medication can often stabilize the condition and prevent further vision loss. However, even with these measures, some individuals may experience progressive vision impairment. Recent research is focusing on developing new imaging techniques for earlier detection and exploring potential therapies to protect or regenerate retinal cells. For example, studies are investigating the role of neuroprotective agents in mitigating retinal damage. The field is constantly evolving, offering hope for improved outcomes in the future.